Good evening. Thank you all for being here. A few hours ago, Maryland's State Public Health Laboratory confirmed the first positive cases of coronavirus in Maryland. Here's what we know right now. The 3 patients are residents of Montgomery County. They include a married couple in their 70s and another individual in their 50s. In all 3 of these cases, the virus was contracted during overseas travel. The Maryland Department of Health has notified all 3 patients of their test results. They are currently cooperating and they're in good condition. They're in quarantine and a thorough investigation is underway to fully determine any of their potential recent interactions with the public. We have notified Vice President Pence along with the CDC. We notified Montgomery County Executive Mark Elrick, Montgomery County Department of Health, and the Superintendent of Montgomery County Public Schools, and we notified House Speaker Adrian Jones and Senate President Bill Ferguson. And while this news is serious, I want to again remind everyone that this is exactly what our state has been actively and aggressively been preparing for many weeks now in order to further mobilize all state resources in response to this threat to public health. I have issued a proclamation declaring a state of emergency in Maryland. With this declaration, I am officially authorizing and directing the Maryland Department of Health and the Emergency Management Agency to ramp up coordination among all state and local agencies and to enable them to fast-track coordination with our state and local health departments and emergency management teams. Earlier today, we submitted our supplemental budget, which included $10 million for emergency coronavirus preparedness expenses. We also submitted emergency legislation to allow us to transfer any necessary resources from the state's rainy day fund for further costs associated with the state's emergency coronavirus response. Given the rapidly evolving nature of this threat to public health, it is critical that we have the flexibility to immediately access these resources. And I want to thank Speaker Jones and President Miller President Ferguson, for their cooperation. And we're very encouraged that this legislation seems to have strong bipartisan support, and our expectation is that the legislature will move quickly on this emergency legislation and get it back to us so that we can enact it and sign it into law. At my direction, the Maryland Department of Health has worked with the Maryland Institute for Emergency Medical Services Systems to coordinate surge planning. Health is coordinating with nursing homes and assisted living facilities on infection control protocols. The Maryland Emergency Management Agency has elevated the state response activation level and fully activated the State Emergency Operations Center to further support resource requests from around the state. The Maryland Department of Education has issued guidance to local school systems regarding their authority to determine school closures if necessary. The Maryland Higher Education Commission is coordinating with the University System of Maryland and other institutions, coordinating with them on bringing students home from study abroad programs and potentially canceling other travel overseas. And all state agencies have reviewed and updated their continuity of operations plans. Our administration's highest priority is keeping our residents safe, and all of the actions that we're taking will allow all levels of government to better collaborate and to respond to this threat in a coordinated and effective manner. While today's news may seem overwhelming, this is not a reason to panic. Marylanders should go to work or go to school just as they normally do. At the same time, I want to continue to remind everyone to prepare themselves and to continue to stay informed. As the CDC warned last week, local schools and daycares should be prepared with contingency plans for potential long-term closures. Local communities and cities should be prepared to modify or postpone or cancel mass gatherings, and local businesses should be ready for office closures that require their employees to work from home. And these are the kinds of things that people should continue to plan for. And we will continue to track this rapidly evolving situation, and we will be receiving almost constant, up-to-the-minute information. The public should be assured that our state's preparedness builds on decades of planning, experience, and expertise gained from previous and ongoing public health events. And we're very fortunate that Maryland has some of the top health research facilities in the world. And I'm confident in our state's ability to respond effectively to these cases of coronavirus, as well as any future cases, and also to be a national leader in responding to this situation and potentially in developing treatments and perhaps even a vaccine. We will continue to update our citizens as the situation develops. All of the latest information can be found by visiting health.maryland.gov/coronavirus. Residents can also dial 211 to connect with a helpline representative to get information and community resources for the coronavirus. Now, at this time, I'm going to turn it over to the Deputy Secretary for Public Health Services, Fran Phillips, who will provide you with some further details. Fran?
Thank you, Governor. Just to echo the Governor's remarks, this development today, the confirmation of 3 positive cases of the coronavirus here in Maryland, is not an unexpected event. We have been preparing for this event with many, many partners across the state. We have been watching very closely, and as it happens, these 3 individuals had specimens that were run in our lab, and so you know that our Maryland Public Health Lab here in Baltimore was brought up into operation earlier this week. And so these are individuals that, as the Governor said, had an exposure in the course of international travel, returned home to Maryland, and when they were notified that they had a possibility of exposure, they were brought to a hospital. Actually, they brought themselves to a hospital because they are not severely ill. They were not hospitalized. They stayed at home and brought themselves to a hospital in order to be tested, in order to have those specimens collected and sent to the Baltimore lab. The results came out this afternoon, and what is happening right now is a very, very thorough investigation using public health resources in consultation with the federal government, the CDC, with the state of Maryland, as well as with Montgomery County Health Department. And this is very important because we want to understand all of the activity, all of the comings and goings of these 3 individuals who are at home, they have remained at home, and they've been extraordinarily cooperative. We want to understand during the period of time when they returned from travel and when they had symptoms, of flu-like symptoms, we want to understand exactly where they went, who they interacted with, in order that we can conduct this investigation. We have tremendous support, as I said, from the CDC as well as from Montgomery County. A very specialized team of disease investigators are working in Montgomery County with these individuals. And we will expect to have more details tomorrow as the investigation progresses. I'm pleased to say that these individuals are very cooperative. Their symptoms are abating. It is a couple, a man and a woman, and another person who is unrelated. So they live in two different households. They are, as I said, cooperative. They are in isolation now. They are not leaving their homes, and we are in very frequent contact with them. I will stop at this point and be happy to answer any questions that you may have. Thank you.
Tell more about their path of travel, where exactly they came from, and their path back home.
Right, so they returned back to their homes, I should say, in Montgomery County late in February from international travel. And so we were notified through the CDC of the fact that they may have been exposed in their trip. And so when we learned that information, we immediately at the State Health Department reached out to these individuals, asked them to come in and to be tested. And so the international travel was the occurrence that caused their exposure. And I think that that's important to point out. Unlike other states, so far this is not cases of community transmission here in Maryland. Now, that's not to say that we will not have that occur, but at this point, these are travel-related cases rather than community-acquired.
At this point, you know where they came from, and also is there concerns of, the contacts they could have after coming back here in Maryland?
Right, thank you for that. We do know where they came from, and we're not going to release that information on the interest of confidentiality. So we want to respect that for these individuals who have been very cooperative as far as the particular details of their travel. As I mentioned, the investigation is exactly that, to understand what kinds of associations they had with people, what kind of contact. Was it casual contact? Was it close contact? Generally, the indication is about 6 feet in distance for kind of public contacts, but we want to understand other family members that may have visited, and all of that is work that's going on right now as we speak in order to develop a ring of contacts that we will then spread out through our public health workforce. Thank you.
Did people travel together, or are they a part of the same family, and were they in the same country? And, yeah.
Right, so as I said, it's a couple, a man and a woman, and the other individual is not related to them, but they were on a similar trip together. So that it was a group that came back at the same time.
So they were
Same trip.
Right, same trip together,
physically together,
correct,
but they're not related.
correct, other than the couple. So it's one single person and then a couple.
Can you tell us what continent that this trip was on?
What continent? I can't do that, no. Thank you. Yeah, it's not relevant, right?
The single person, male and female?
The single person is a female. Single person is a female in her 50s, and the married couple are older. It's 70-year-olds.
Do any of them have any underlying medical conditions like a compromised immune system or cardiovascular system that would cause this to be more problematic, or are they back on the upswing and everything will be fine?
Well, we don't know their medical history at this point. We will be investigating that. Fortunately, they were, I would say, mild to moderately ill, so they were not hospitalized, and as a result, I can say that their symptoms are abating at this point.
Can you say if they came through an airport or a cruise? How did they come back?
We don't have exactly the information on their travel, all of the conveyances that brought them from overseas back home to Montgomery County, so I really can't answer that in great detail.
Did they fly through an airport in our area?
I can't answer that at this point.
Can you talk about how you're tracking international travelers? I think earlier today that you said that you're monitoring some 300-plus people by phone who are
Right.
asymptomatic. Can you
Right.
talk about that?
Sure. That's an effort that's been going on for about 2 weeks now. That started when the Americans were asked to come back from China. And they came back through 3 so-called funneling airports. The federal government in those airports notified the state health departments of people returning from China back to our jurisdictions. They did airport screens at that time, fever checks and whatnot. So people that were asymptomatic on their arrival were sent home, asked to stay home for 14 days. We got those names, and we do monitoring. We do phone check-in with those individuals. Now it's gone beyond China. It's to include Italy. It's to include Iran. It's to include South Korea. So those counts, those counts of people that we are doing the phone monitoring on, has been, I guess, underway for about 2 weeks now.
And are you expanding testing?
Yes, yes.
Who's testing?
Yes, well, that was another development. Yesterday, we have new guidance from the CDC. You know, there's been criteria that have slowly been liberalized, or relaxed, I should say, in terms of what kinds of risks would be qualified to be tested. And so just yesterday, the CDC took another step to expand somewhat those criteria. And so we here in Maryland are applying that same criteria and informing all of the clinicians, about 3,800 clinicians, licensed physicians, nurse practitioners, and physician's assistants, of this new guidance through email, so that they'll be aware of testing. We're very relieved now that we have testing here in Maryland, because it means that the turnaround time is so much quicker, and people who have pending tests are asked, of course, to stay home until we get the results of the test. So this compresses the amount of time of that disruption for them.
Can we clarify on the timeline? So they came back, you said they went to hospital, they went home. Can we just clarify a little bit of it on the timeline?
Sure. We got information about these individuals we know that they returned to Maryland on February 20th. We got information about their situation on March 3rd in the evening. We contacted them in the morning, excuse me, on March 4th, and collected specimens at that time, and were able to turn around the test results today.
Can you, ma'am, do you know which hospital or hospitals they went to, and can you tell us which ones?
I do know which hospital, and it's one hospital, and no, I will not release that at this point. They came in protective precautions. They came into the emergency room simply for the collection of those specimens, and then they were released. So that was a very good service that the hospital provided, not only to collect the specimens, careful packaging, and get them to the lab through courier right away.
And you mentioned the school superintendent, contacting the school superintendent. Have they been in contact with some students from the district?
We don't have indication of that, and that's really a matter of protocol, so that we want to make sure that local officials, whether that's the school superintendent, certainly the elected officials, the health officer, as well as the emergency management officials, would know about such an instance. So that was a matter of protocol, just for advisory purposes. We don't have any information about any of these individuals having contact with Montgomery County schools or school-aged children at this point.
So is anyone else being quarantined as a result of these results?
Not at this point in time.
Are they self-quarantined, or are they quarantined in a medical facility?
They're at home. They're at home.
So just so I can be clear, because I wasn't sure if I heard you say February, did you say February 20th is when they returned?
Yes,
So that's 12 days.
correct.
I'm sure that the very first question that you've been asking them is, in that 12-day period, where were they, where there were large groups of people, or in which they interacted with people and got into that 6-foot radius? Do you have a sense, and have you pinpointed those places where they would have interacted with the public?
No, this is very new, but you're exactly right. That's exactly the kind of questions that we want to ask. Asking people to go back on their calendars day by day and retrace their lives in great detail. And so that's exactly what's happening now. We don't have indications right now of other groups or other locations that we need to focus on. But we expect to get that very quickly, so that work is carrying on as we speak.
Are you saying that they didn't interact with anyone at the hospital that they went to have the specimen collected?
Oh, yes, they did. The hospital was aware in advance. We called ahead to make sure that they were aware that they were coming, and they were received by the hospital with staff that was fully protected in personal protective equipment. So that was, and actually that's a really good question, because that brings up the question of how people should respond if they themselves have symptoms and are concerned. And so that opens up a lot of questions, and I would like to give a little help on that. People are worried. Of course, this is flu season, and people hearing this news may be worried about their own symptoms. And that's legitimate to do. People that have symptoms such as a high fever or a fever of 100.4 with a cough and difficulty breathing, those are some of the symptoms of this new coronavirus disease. People that have those symptoms really should think about their own underlying conditions if they have medical conditions. People that are older and are experiencing those conditions should call their healthcare provider. Call and get some advice. If the decision is made for you to come in, go in carefully, but call ahead. Have people know that you're coming so you can protect the healthcare providers as well as others in the waiting room.
So you all know for a fact that they didn't come into contact with anyone else via an emergency room? And if not, why wouldn't you reveal the name of the hospital that they went to?
Well, the hospital was fully prepared for the entry of these patients. And so it's really a matter for the hospital to be able to look carefully at the procedures. And the hospital has asked, and it is not germane to the investigation. We know that that hospital was protected and have great confidence in their ability to manage that specimen.
So they basically called ahead.
Absolutely, they called it. Yes, we did, yes. We wanted to make sure that the staff knew. We wanted to make sure that we had the entrance that was secured as far as how the patients would arrive, and that all of the test equipment was available.
Last question, please.
Was this when they did the test, or was this when they initially went to the hospital for the first time because they weren't feeling well? Or did they go to a hospital initially?
No, this was for the test.
Thank you.
Thank you all very much.